use like consciously or?
Yeah, I think people get that, a physician is a really good doctor is someone who can help, but it's not someone who dictates the outcome. In the end, a lot of this stuff, there's a lot out of our control in medicine, and there is some in our control. And so I think the more what I would strive for, what I would tell our residents and fellows to strive for these conversations is that if the person walks out of that room saying that person is capable and is totally dedicated to bringing the best of everything they've got to be on my team, that's what I can ask for out of that visit. Not more, not a good outcome.
Right.
They can't guarantee a good outcome, right?
Right.
There's a humility to it, but I think there is also a divorcing yourself from the outcome of the disease being the only thing you can offer somebody. It's not. And I think in medicine, we really go in saying like, cancer is going to be cured or not cured. It's binary, success, failure, right? And of course, as surgeons, we really kind of pathologically look at the world that way sometimes. I mean, it either goes well or it doesn't. It's totally not right. They're some of the closest relationships I've got are with folks who either passed away or with the loved ones of people who passed away. And like, do I sit and stare at the ceiling and say like, what could we have done differently? Is there anything, anywhere we missed something? Of course. But I think I also get more kind of inner fulfillment from sitting down and talking to parents years after their kid passed away and staying connected to them and knowing that, we celebrate that kid and that person and that life together, and that we both saw magic in that kid, and that we tried to provide things during that process. Even losing a battle to cancer, we provided support in many other ways. We provided kids a chance to do things. We provided them someone in their corner. So emotionally, it was less scary to go through that. I mean, we're all going to die, right? And so that process, as unthinkable as it is, when you sit and talk to parents who say, I lost my kid, but like the humanity that your team, that people on your team, that Dr. Smith, Dr. Jones, whoever it was, showed us through that, always gave, this kid, our kid, he never dreaded these visits. Even though he knew he was getting perpetually bad news at these visits, he never dreaded them. He connected with people. He looked forward to being here. He felt better walking out knowing facts, even if they were bad outcome, because he felt his team was tirelessly working for him.
Mm-hmm. Mm-hmm.
And so I think in medicine, like that's part of the deal, right?